Alright, hey, this is Miss Roberts. I'm covering chapter 26, caring for a child with cancer. It starts on page 872 in your book. Just kind of walks through different challenges, epidemiology, the physiology of cancer, and the pattern of the tumor. Okay, an atypical cell. Atypical cell. So this is what a typical cell looks like, and then there's different staging of the cancers. Okay. Early detection, of course, is best. Okay. You need to be teaching your parents when they come for well checks. Teach them to look for different things. Change in bowel movement, a sore that's not healing, unusual bleeding, thickening, or a lump on any part of the skin, especially the breast or testicle, those hormonal parts. Difficulty swallowing, gagging, coughing, hoarseness in the throat, and this is not just a boy, his voice dropping when he's a teenager. This is something that you would notice differently than that. A thickened or the wart, mole, mouth sore that's not healing. Weight loss of appetite. This is not just picky kids, okay, that only want to eat chicken nuggets. This is something that's a different symptom, okay. Persistent headaches, low-grade fevers, constant or intermittent, and repeated infections. Okay, so just they need to know what to look for, just to be observant in their child. Okay. Leukemia. This is our blood-forming cancer, cell cancers, blood-forming cell cancer, leukemia. Okay. Normal bone marrow elements. This is a winking lollipop. Normal bone marrow elements are replaced with large amounts of immature lymphocytes. Okay, so this is the crowding out of the normal ones and replaced with the immature. Then you have the pancytopenia, the low blood levels. They're just not producing as they should. Their white count is going to be low, very low. Okay. 3 major classifications of leukemia are listed here. You have ALL, AML, and then chronic lymphocytic leukemia. Okay. But you need to know abnormally low level of all blood cells. Okay. Some more winks and lollipops here. The myelodysplastic leukemia. This is when there's not enough produced. Okay, not just immature, but there's not enough bone marrow. Does not produce enough of it. So it's a little bit different than it producing immature versus not enough. Okay, and that's the MDS. The ALL. This is the most common type of leukemia in children. It accounts for about 75 to 80% of all childhood cancers. Okay. Signs and symptoms you need to know. Okay. Some more winks and lollipops. All right. Fever. 50% of the cases there's fever. Fatigue and lethargy. Okay. Bone or joint pain in about 1/3 of the cases. And then they just refuse to walk because it hurts so bad. Okay. These are some signs and symptoms. Bleeding under the skin or in the mouth, sometimes in the eyes, is a less common but still present sign. Okay. Petechia, hepatomegaly can be noted. Some winks and lollipops. Okay. How do you diagnose it? So, of course, blood work, right? Because that's what it affects. I want you to read through all of this, know what's going on here. Okay. Worst prognosis is associated with initial WVC of being 50 or less in children older than 10 years. Infants younger than a year at the time of diagnosis have a very, very poor prognosis. We need to be initiating, as nurses, we need to be initiating bleeding precaution, okay? Wink and lollipop, write this down. It's in my book. Bruising even. Note the bruising, okay? And then I have another sticky note if you want to write this down with the ALL, which is the acute lymphocytic leukemia. With chemo, you're going to see 4 things, okay? Alopecia, peripheral neuropathy, hemorrhage, and tumor lysis. And you know that's the breakdown of the red blood cells that's in the tumor, okay? So I'll say it again. ALL with chemo, you're going to see 4 things. The alopecia, of course the hair loss, peripheral neuropathy, they're going to hurt from head to toe, hemorrhaging, they can hemorrhage, that's why you take bleeding precautions, and tumor lysis, okay? And there's some symptoms there. Alright, solid tumors before we talk about Wilms tumor. Let's look on page 878. Neuroblastomas are mentioned there. Go back up. Solid tumors. So read through this. Brain tumors, sarcomas, carcinomas, lymphomas. Read through all of this, okay? Lymphomas are cancers such as in the lymph node, the spleen, the thymus. So everything just drops where they have no white count, no anything, blood count. I want you to read this, what to say. Children, when a child is diagnosed with a brain tumor, just read through that. Surgical, cutting out the tumor correlates with the prognosis. Of course, can they remove it all? Is it contained in one specific area? And then perioperative care, read through this, okay? There's some winks and lollipops in here. So after resection, a huge thing to do is a neuro check, right? They're removing a brain tumor, your priority is a neuro assessment, okay? Priority, neuro assessment. You need to be in there checking some LOCs, okay? Unfortunately, and this is in your book, at the time of diagnosis, 75% of patients with a neuroblastoma have a tumor that's already spread or metastasized to another site. So it's very sad when we talk about neuroblastomas, okay? They're usually already mets all over their bodies. And that's right here. Just something to know about neuroblastomas. It's the 3rd most common pediatric after leukemia and brain tumors. All right. And this is on page 880, Wilms tumor, okay? So it's a nephroblastoma. Nephro is what? Kidneys, right? A tumor on the kidneys that can originate on one or both of them, okay? Max Wilms is who it was named after. What actually causes it, we have no idea. 90% of all kidney tumors are Wilms tumor, and this is the 4th most common, okay? Unlike neuroblastomas, the mass is frequently present on one side and very seldom crosses the midline. Okay, so that's something that you need to know. It's very seldom crossing the midline. Clinical judgment alert. I cannot explain this more. You never, ever, ever palpate the abdomen with someone with Wilms tumor. Never. If you walk in the room and there's not been a sign put up that no abdominal palpations, you need to be making it like neon flashing sign. Do not palpate the abdomen. You palpate the abdomen on someone with a Wilms tumor, it can rupture it and cause further metastasis, okay? Never, ever, ever palpate a child with a Wilms tumor. Palpate the abdomen of a child with a Wilms tumor, okay? Never. You're going to see abdominal pain, blood in the urine, fever, loss of appetite. They are not feeling good at all, okay? There's a case study there that you need to do, but it's so important to remember never to palpate the abdomen on a Wilms tumor patient. (883) talks about lymphomas. This is talking about bone tumors. You can read through that. Ewing sarcoma, you can read through that. That's the bone and the soft tissue. And then lymphomas, Hodgkin's and non-Hodgkin's, okay? There's two types. One is Hodgkin's, one is non-Hodgkin's, okay? You need to read through those, know the difference of those right there. Predominance are in males younger than 10. You can read through the onset. It's painless. Lymphadenopathy is your biggest sign. Let me just read through that. 885. And see, this is what it looks like, the Hodgkin's ones. You see the lymphadenopathy here. All right. 885, the very bottom, holistic nursing care of a child with cancer. The nurse needs to be assessing for signs and symptoms and of bleeding and infection, okay, on all of these winks and lollipops, okay. You need to know what to look for. You need to be aware of what to look for in a patient. Winks and lollipops. That's that holistic nursing care, okay? Nutrition. Growth and development, nutrition. For the child with cancer, demands are different. They may not want to eat what you bring them, okay? But as long as they're eating something, we're good, okay? Try to make it as nutritional as possible, but if they refuse and all they want are Fruit Loops like this child's eating, then give them Fruit Loops, okay? Something is better than nothing. Box 26-1 on 887, let's look at that. Like we just talked about, the poor appetite. So offer small amounts several times a day. Frequent meals. Offer liquids in between meals. And then I have written in my book to push liquids following meals and to try ice between meals, okay? So winks and lollipops. And then try ice. Get them a cup of ice and let them get that liquid in them however they will. And then push those liquids in between meals. Chemotherapy. Primary treatment for pediatric cancer and just some different drugs. Okay, so what kind of side effects do we have? We have some pretty significant side effects, right, for chemo drugs. One that I want you to know is cytosine, okay? This is cyclophosphamide. Here, some winks and lollipops. You need to know about this one, okay? It's used for Wilms tumor. It's used for ALL, sarcomas even. But there's some side effects. One of those big side effects is hemorrhagic cystitis. Okay, hemorrhagic cystitis is when your bladder looks like this right here instead of this right here. Very bad. And we're going to talk about that in some other. Let's see. Very painful though. But your bladder gets inflamed and passes a lot of blood, and you're going to see that as a side effect with cytazan or Neosar. Okay. All right. 892. Psychosocial support is very important when you're dealing with cancer. Winks and lollipops here. Okay, make sure you understand how important it is to provide that psychosocial support to the child and the family. Okay, being present, just simply listening is powerful. Listen to that child. Sit down. You know, they may not feel comfortable always talking to their parents about absolutely everything, especially teenagers. So a neutral person, like us as nurses, they may open up to. Okay, give them reliable internet sources, not some Wikipedia stuff, but reliable evidence-based practice. Okay, resources. Nausea, vomiting, some more winks and lollipops here. Okay. Major negative effect of chemo is nausea, vomiting. Okay, it can persist for weeks, and about the time they get over it, they have to go for another chemo treatment. Usually peaks 48 to 72 hours after the chemo, and they are at risk for nutritional compromise. That's written in my book. They are at risk for nutritional compromise. Sometimes you may have situations, and we'll talk about this in class, but where the nurse should always talk to the provider if a teenager is refusing treatment, but the parents want the treatment, because it's ultimately, if you have a 17-year-old that'll be an adult in 6 months or a year, and they're sick of doing chemo, then you need to talk to the provider, because they're the only person that can override that parent's decision for treatment on a child. 894 is talking about anemia. Of course, this can happen during chemotherapy as well. Good cells are killed while the bad cells are killed. Okay, so it can cause anemia. And this is winks and lollipops. Okay, some signs are, of course, fatigue, headache, irritability, tachycardia, and I have this written in my book. Anemia can cause difficulty concentrating due to the brain not getting enough oxygen. Okay, so anemia can cause difficulty concentrating due to the brain not getting enough oxygen. All right, then we're going to go back to hemorrhagic cystitis. Okay, I thought we were going to go back, and we are. Here on page 895. So remember the picture I showed you here, right? Just be aware that that drug, that cytazan drug, can cause that. Okay, this is this is winks and lollipops. So So know all of this. Bloody or painful urination with this is it is a medical emergency. Okay, you need to let somebody know right then. You need to be checking, especially every single time when they're on cytosine. You need to be doing urine dipsticks. Okay, you're checking for the RBCs in the urine. Okay, it's painful. They're going to tell you it hurts to go empty my bladder. Okay, it's painful because it's damaged the epithelial lining of the bladder. It burns, and they use this drug for ALL. So, especially if you work in a cancer center, you may see that. 896, tumor lysis syndrome. Remember, this is the breakdown of the tumor, and it can be life-threatening. Okay, Burkitt's lymphoma, lymphoblastic lymphoma, T cells, and ALL are all with this. Okay, the levels, the potassium, phosphorus, and uric acid are increased, and the calcium is decreased. Okay, you can have kidney damage, you can have arrhythmias, muscle cramps, weakness, and even seizures. Okay, with this going, when this cancer cell breaking down. Okay. But you need to know which cancers are associated. So, right here, winks and lollipops. Okay, and that is it for chapter 26.